Good morning. Happy New Year.
Morning, Kathy.
Thank you. We'll get started I still see folks joining, so we'll get started in 45 seconds or so, maybe. Welcome, good morning.
Good morning, everyone.
Okay, we're gonna go ahead and get started with introductions. I know some folks are still joining, but we have a very packed agenda, so I want to make sure we get through everything. So we'll start with names, pronouns, and either the organization you're with or what brings you here today. We'll start as usual with MAC members and alternates who are here. Then we'll jump over to MaineCare staff and then come back to catch any MAC members and alternates that we've missed. And then we'll give guests an opportunity to introduce themselves. You're also welcome as a guest to introduce yourself in the chat. So I'll kick us off. My name is Kathy Cohen Del Rio. I use she, her pronouns. I'm with Maine Equal Justice and I'm chair of the MAC. And just to know, we still don't have a vice chair of the MAC. So if anyone who is a MAC member is interested in that role, we would welcome you. And I just realized, hold on, I had to restart my computer and now my list is not open. Hold on one second. Knew there was something I was forgetting. I also just want to make a note about the agenda while I open up my list, that I had to make an adjustment to the times and I mixed up the schedule a little. So just to note, Sarah Fisher will have 20 minutes on the agenda and the MaineCare update section when Michelle gets here will be 10 minutes. So sorry about that confusion. Okay, so oops. So what I'll do is I'll go through the list of MAC members and you can introduce yourselves as we go through. Miriam Bashir, Norma Desjardins, Catherine Brandt, Jessica Drenning, Jamie Burke, Adam Bloom Oh, Adam, I'm sorry. The new year I forgot.
No worries, Kathy. Adam Bloom Pykopoulos, Executive Director at the Alliance for Addiction and Mental Health Services.
Welcome. Kathy Dion, Becca Matasovich, or Kaylee Hess.
Yes, hi, I'm Kaylee Hess, alternate for Becca, she, her pronouns, Children's Oral Health Network of Maine.
Vicki McCarty.
Hi, I'm Vicki McCarty, and I'm with the Consumer Counsel System of Maine, which is a group of folks who are made up of people with lived experience with mental health issues, including staff and members. Good morning to everyone.
Good morning. Rachel Collmore.
Good morning, everybody. Happy New Year. Rachel Collmore, Consumers for Affordable Healthcare, she, her, hers.
Sarah Squires.
Sorry about that. Sarah Squires, she, her pronouns, Public Policy Director at Disability Rights, Maine.
Gia Drew,
Good morning, Gia Drew, Executive Director at Equality Maine, she, her.
Susan White,
Good morning, Susan White. I'm representing the Home Care and Hospice Alliance.
Catherine Hamilton, Leo Delicata,
Good morning, Leo Delicata, Legal Services for Maine Elders, and I use he, him pronouns.
Sarah Lewis, Laura Cordes,
And good morning. Happy New Year, everyone. Laura Cordes with the Maine Association for Community Service Providers, MAXPE.
Rachel Dyer,
Hi, I'm Rachel Dyer with the Maine Developmental Disabilities Council, and I use she, her pronouns.
David Winslow, Ann Sedlak,
Hi all, Ann Sedlak. I'm the Director of Advocacy at the Maine Medical Association, and I use she, her pronouns.
Bobby Martin,
Hi, everybody. Bobby Martin with the Maine Primary Care Association. I use he, him pronouns.
Andy Henderly, Teresa Cochran, or Kristen Goddard. Are there any, I know there were still a few folks joining as we started introductions. Are there any MAC members or alternates who I missed? Okay, I'm going to pass it over to Maine Care then, and Kayla, I'll give it to you first.
Thanks, Kathy. Hi, everyone. My name is Kayla Sargent. I use she, her pronoun. I'm the Associate Director of Strategic Planning and Communications here at the Office of Maine Care, and I will pass it to Sanaa Osman.
Hi, everyone. Good morning and Happy New Year. My name is Sana Osman. I'm the Member Engagement Manager at the Office of Maine Care Services. And I would like to introduce our new Member Engagement Coordinator, Katrina Roberts. This is her second day, so please welcome her to the MAC meeting. Katrina, Kat.
Hi, everybody. I'm Kat Roberts. I am definitely new with Maine Care Services. I use she, her pronouns, and I am the new Member Engagement Coordinator. And I'll pass it to Sarah.
Thanks, Kat. Hi, everyone. I'm Sarah Fisher. I'm the Maine Care Outreach Specialist at OMS, and I use she, her pronouns. I'll pass it to Jessica.
Good morning. I'm Jessica Miller, Associate Director of Policy at OMS. I use she, her pronouns, and I'll pass it to Becky Parsons.
Hi, I'm Becky Parsons. I'm the EPSCD Program Coordinator with Maine Care. And I'm not sure who's left. Lisa?
Good morning, Lisa Weaver with the Office of Maine Care Services, and I use she, her pronouns, and I'll pass it to Amanda Lee.
Good morning, Amanda Lee, she, her pronouns, and I am the rate setting coordinator at Maine Care. I was just trying to see who's next. I think Tammy, is Tammy Sheehan on?
Yeah. Good morning, my name's Tammy Sheehan. I work with the pharmacy unit with the Office of Maine Care Services. She, her pronouns, and I'm not sure who's left, so somebody can jump in that hasn't.
That all the Maine
That's
Care
everybody.
folks?
Oh, sorry.
That's okay, Lisa.
Michelle will be joining later, but I think that's everybody for now. Oh, Ian is in the waiting room, so Ian is on his way.
Okay, great. I'll just come back again real quick. Are there any MAC members or alternates who we missed?
Kathy, it's Mark Eves, alternate for MAXPE. I saw Laura here. I put my name in the chat as well, but Executive Director of Woodford Family Services, he, him, and good to be here. Good to see you all.
Great, thank you. And I know I see a lot of guests have introduced themselves in the chat. Are there any guests who'd like to take themselves off mute to introduce themselves? Great. Okay. And then just again, because a few folks came in after I said this, I did make a mistake in the agenda, and that Sarah Fisher's section should be 20 minutes and the main care update section should be 10 minutes. So we'll make those adjustments as we go along, but just don't be surprised when Sarah's going longer than it looks like in the agenda, because that is intended. Thank you all. So we're gonna kick it off with updates from OFI. And Ian, I see you have joined us. We were hoping to hear any last updates around the unwinding, and also there was the question about wait times that had come from the provider subgroup before. So I'll pass it over to you.
Sure. Good morning. Thanks for having me here today. I'm gonna pull up the we had a final blog post for unwinding. So I'm just gonna find that and put it into the chat from last month. I haven't had a chance to go through and compare these results with the national unwinding data. I think that'll be something that I try to do this spring and would be happy to share in the future on, although at this point it's over. So your discretion if you'd like to hear more updates. I think it's pretty safe to say that Maine had a nationally leading unwinding effort. I just don't have the specific comparison points. And there are a couple asterisks, especially with kids expansion that occurred during the public health emergency and subsequent unwinding efforts that are worth, remembering that Maine is one of, I think, 7 states that expanded eligibility during this time period. So our unwinding efforts are, you're looking at total membership, not just how many people were disenrolled through unwinding as success rates. That at the national level, but just I think in general saying we had a very successful effort over the 15-month unwinding period from May 2023 to October 2024. We had over 345,000 main care members successfully renew and retain their coverage, and that is a little bit north of 83%. Of main care members kept coverage, and over 30% of those members were renewed automatically without having to complete a paper renewal form. That rate has increased pretty significantly now that we're doing the individual renewals, and we've seen that closer to 75% of main care members who are renewing their main care coverage every month. An asterisk to that is that for main care members whose coverage is renewed automatically, who also have SNAP, they still need to manually renew their SNAP coverage, often providing the same information. So it's not reducing necessarily the work that they're doing. The actual renewal rate is still closer to the 30% of members who really don't have to do anything, but there still are a lot of members who are able to renew automatically on the main care side, even if they have SNAP now. And if households have kids in them that can renew automatically, even if we need information for the parents, we're renewing everybody that we can automatically. So that's an exciting thing to stay. But that's the sort of summary of how unwinding went. I think I'd be happy to try to take any questions that you have. The final dashboard is available. The link I'll put in there too, just in case you did want to look at any of the numbers. And it looks like it actually has it didn't get updated for the end of October, so I'll follow up on that. But that's the unwinding information. I wasn't able to pull together any slides for the call center wait time question. I think there's a couple of things that I could share in terms of what we've seen going on with the call center more recently. But maybe I'll pause first and see if there's any unwinding questions. before I go into that.
I don't see any questions, but I did just want to acknowledge like the lots of hard work that went into making unwinding such a success in Maine. And it was so good to see here that we took so many steps to try to protect people as much as possible for as long as possible, as compared to some states where we saw lots of people being disenrolled really quickly or disenrolled in ways that were inappropriate. So just want to acknowledge that and appreciate it.
Yeah, thanks. And I know a lot of folks in this group were a part of that as well. There's a lot of outreach that folks did to make sure people know about completing their renewals. And a lot of our team here has spent the past 15 months, or I mean, really more, because we were planning for this before it started, getting all this stuff done. And a lot of things that we did, again, for these, a lot of things that we learned and that we were able to do through the unwinding process are things that we're continuing to do to make the renewal process as easy as possible for people going forward. So I think that's probably the most exciting piece, like getting through unwinding and having as low procedural disenrollment percentages as we had is definitely something to celebrate. And then for current members, the nice thing is that unwinding is just what they do every year now. And that process is now significantly easier than it was back in 2019, the last time that people went through their annual renewals, especially not only because they're automated for so many people, but also because there's additional reminders that we're able to send people, and we've made that process just easier. So thanks for that. So I'm not hearing any questions about unwinding. Oh, go ahead.
Hey, hi, Ian. So just real quick, I think I'm not sure how to tie this into the conversation, but I think it might be helpful even going forward. I think the biggest hurdle we had as far as MaineCare members and the unwinding was procedural terminations, and there were people who didn't realize that a procedural determination wasn't like a proper MaineCare determination that would allow them to move into the marketplace. They assumed that because their MaineCare was ending, that meant that they could move in. And I wonder if there's some, and notice the decisions are just a wonky letter for just because of the nature of what they are. But there seemed to be some confusion that people assume that if no matter how their MaineCare ended, if it's because they assumed they weren't eligible, so they didn't complete their renewal and were then ready to move to marketplace, that created some confusion, and we had a few hiccups here and there with people. Does that make sense?
It does make sense. We're planning on having a debrief with the Office of Health Insurance Marketplace around open enrollment in particular, and how we can make the transition, what improvements we could make in the next cycle for the people that transition between MaineCare and Marketplace. So I definitely recognize the challenge. I don't have any immediate, like, here's what we're gonna do for next steps, but I would definitely welcome more conversation about either improvements that could go into notices of decision so that people realize what their options are, or better information for call center staff to have in terms of just explaining, what different decisions mean for marketplace coverage. But we definitely are also working on having that debrief between OFI and marketplace, and just looking at how we can make those transitions back and forth easier.
Okay, that's
the-
excellent. I think that I find that really encouraging because it's just that transition, and when you don't have the right information, that itself can be a barrier. So thank you, Ian. I appreciate it.
Yeah, and definitely do welcome if, there are specific suggestions for wording and things, definitely welcome suggestions for that. And on the flip side of that, and not really unwinding related, but this year was also a lot smoother for people that needed to interact with both OFI and OHIM for open enrollment. We completed the vast majority of the referrals that came from OHIM to us before the open enrollment deadline, where last year many of those main care decisions were made after the open enrollment deadline. So that caused a lot, like this time last year, there's a lot of people who were confused because they had been denied main care coverage after the open enrollment deadline, or they had been, they were receiving main care coverage, but they also already had started paying for marketplace coverage because it was after the deadline. So we had a much better process for that this year overall, in terms of just having the main care decisions made timely, though I know that it's frustrating for members when we get around 10,000 applications on the same day. It's hard for us to turn those around on anything less than the 45-day turnaround time for main care applications. That's a long time for people who are used to like the instant decision of a marketplace decision. So we're hoping that we can continue to find ways to decrease those referrals, particularly by letting marketplace consumers know about the things that they need to do on the OHIM side to update. Like people get referred to us if their income ends on the marketplace, so they appear to be main care eligible, but it's really just like the marketplace application wasn't filled out correctly. But we can't undo the referral once it happens. So there's definitely some conversation about what we could do on both sides to make the transitions that have to occur smoother, and then also to we ideally minimize the transitions that don't have to occur as well. So thank you.
And do you want to go on about the wait times question?
Yeah, so is it helpful to do kind of like a quick like overview of when you call our 855 number, like what happens?
I think that is helpful.
Okay, so if you call OFI, all of our calls initially start in what we call a clerical queue or a triage queue. So all of our calls received are answered by OFI, initially by a clerical staff member who can perform some simple requests or answer some simple questions, but can't make eligibility decisions or complete some tasks that may seem simple, like changing an address, but that actually have eligibility implications, particularly for people who receive SNAP, where even moving into a different town could change. There's lots of things that could change with SNAP when you move. And so it's just clarifying that some things that people think are simple actually still have to go to an eligibility specialist, and they can't be resolved at that clerical level. And so the first wait time that people experience is like, how many minutes do you have to wait to speak to to the first person that you talk to, a clerical staff member? During the unwinding process, we also, and there are things that people can do instead of waiting. One of those includes an interactive voice response menu, where some of those simple changes and updates that people make could be, you could process them on the phone without speaking to somebody, and then that task will come over for us to work, and we'll do that without you having to actually talk to us. But in terms of people who actually do want to talk to us, typically they're going to go to that clerical staff member first and explain what they are trying to ask a question about or trying to do, and then the clerical staff member will either help them answer the question, do the task, or say, I can't do that, I need to transfer you to an eligibility specialist. During the unwinding process, we also added an option for people who had only questions about main care to go into a main care only queue that would essentially have a less wait time than the SNAP and other eligibility questions that people have. And it's just an additional option for people who again had only main care questions. So we now have sort of like two initial routes that people can have to talk to somebody. You can go in the clerical queue, which could be for a main care question, or it could be for SNAP or TANF or anything else. Or if it's really only main care, there's an option. I can't remember what number it is, but you press that and you go straight to a main care queue, which is generally staffed by people who can both answer a question and make a main care eligibility decision over the phone. So the wait time for the clerical queue, and let me just, the wait time for the clerical queue during the unwinding process, we had a significantly higher amount of staff on that, which we had some contracted staff who were supporting the unwinding process. So generally for almost all of 2024, the wait time for the clerical queue was like under 5 minutes. In many cases, under a minute. Like you were getting answered pretty quickly. Since the unwinding process has ended and some of those contracted resources are no longer with us, the wait time for the clerical queue has increased. And I believe that it's in the average of 5 to 10 minutes right now. But I'd have to get that. But for people who were having their calls answered in like under a minute, that's generally not the case. It does depend on the time of day and day of the week, and there's certain weeks of the month that are busier for us. But generally speaking, our wait time is pretty low for that. For the main care line, I actually don't have the wait time for that right in front of me right now. So I'm sorry that I don't have that available, but that again is just a different option that folks have. The wait that people often have questions about is then so for a lot of people, if you have a simple question, generally you're going to wait between 5 and 10 minutes right now for us to answer your call, to answer that question or do what you need us to do. If you have to get transferred to an eligibility specialist, I think that's where folks can experience longer wait time. That's often been the concern that folks have. And that wait time can approach, generally, I think it's pretty safe to say that the wait time to speak to an eligibility specialist is going to be closer to an hour. And there are times when we aren't always able to transfer calls to an eligibility specialist, especially towards the end of the day when the wait time might exceed, like if it's going to be an hour on hold and we're going to close, we don't want to transfer you and then just have the call get disconnected. Since the unwinding process began, we haven't seen significant changes in that wait time. I mean, the staffing that we have available for that has been pretty consistent over the past year. So there hasn't been a significant change in wait time for eligibility specialists. We have generally seen instead improvement in the options that people have. So instead of having to wait on hold for an hour, you can request a callback and we'll call you back sort of in the first available option. And then you also can request a callback at a specific time, either that day or the following, I think next couple days, people can use, and that way you don't have to spend time on hold. And if you're going to be busy, you also can pick a time that's more convenient for you. So we've seen some improvement there. And then I think for the more long-term improvement with wait times, we received in the last supplemental budget an additional 20 eligibility specialist positions. And those positions were hired in August of 2024. And those positions have now completed training. And this month they are involved in what we call learning and working. So where they're actually processing eligibility applications and renewals for MaineCare and SNAP now with mentoring with their peers. And at the end of this month, they'll sort of end that mentoring process, and we can start, because you can't really mentor somebody easily on the phone. They will start being available for assignment to the phone queue next month. So we do expect to make some improvement in the eligibility in the wait time to reach an eligibility specialist. We expect to see improvement on that next month once we start being able to assign more staff to that queue without impacting application processing times and renewal processing times, because that's essentially the same pool of staff that we have available on any given day. We have around 200 eligibility staff available, and they can either be processing applications, processing renewals, answering phone calls, or assisting clients with walk-in visits. So that's the balancing act that we play every day of trying to keep the wait times as low as possible, while also making sure that people get their eligibility decisions made within 30 days for a SNAP application and 45 days for a MaineCare only application. So I think I would hope at the next meeting that I could share some more sort of results from what we've seen by being able to assign more staff to the eligibility phone queue. But essentially, for all of last year, we had roughly the same number of staff on that on any given day. We usually assign around 60 of the 200 eligibility specialists on any given day. We assign around 60 people to answer phone calls. The other thing that we're working on in terms of improving long-term call center wait times for OFI is we received a grant from FNS that I don't remember the exact name for, but it's a performance and technology related grant. And we're going to be working on some of the things that we saw work during the unwinding process in terms of being able to send more proactive communication to members about their renewal status and increasing those notifications to include other things that people often call us about. So when we receive an application and start processing it, for example, that we could send somebody a notification and let somebody know that we're processing your application. So you don't have to call us to know what we're doing with your application. We'll let you know. We just received that grant, so we're probably a year or so out from being able to actually implement those activities, but that's there's sort of two ways that we can reduce call center wait times. One of them we're looking forward to doing very soon, which is to put more eligibility specialists on the phone queue every day. And then the second thing we can do to reduce wait times is to reduce the reasons why people have to call us in the first place, by sending more proactive communication to people, letting them know when their EBT cards are getting sent out and other things, so that you don't always have to call us as the only way to know what the current status of your application or renewal is. But anyway, I hope that that's helpful as an overview. Happy to answer any more questions. We do also have a new DHHS by the numbers dashboard on the department's website, and there is some average call center wait time for OFI metrics that'll get updated, I think, quarterly, and that are currently posted as well for people who are interested in just looking at some of the numbers. We're now posting those publicly. And then I also had, in terms of the numbers that we report, when we report our call center wait times to CMS, we generally take an average because there's lots of different times that you could wait. So we take an average of all of the calls that we have and all of the different queues and the wait that each of the calls has. And that's what we report as our average call center wait time. So we did see, we were averaging 8 months for the month of October. And then that increased to 13 minutes as an average across OFI for the month of November, with the caveat that, of course, people will experience different wait times based on what question that they have for us and whether or not they immediately request to go to the main care only queue, or if they go through the clerical triage process and then into the eligibility queue. There can be different wait times for different lines, but that average is across all calls received for main care for all of those lines.
Thank you, Ian. I'm actually going to ask folks if they have questions to put them in the chat, just because we're a little over on time right now, and also appreciate your offer to talk more about this at a future meeting, because I think it would be good to hear how things shift. Thank you so much. And now we're going to pass it over to Sarah Fisher, and we'll make some adjustments later in the agenda to catch up on time. And Sarah, I'll pass it to you.
Thanks, Kathy. I can also see how fast I can talk. I can shave some time off here. Again, I'm Sarah Fisher. I'm the Main Care Outreach Specialist for OMS, and I'm going to give a presentation. Can everyone see, sorry, the screen that, like the full shared presentation, not the notes?
Yes.
Like,
yes.
Okay, thanks. Working with two screens here. I'm here to talk about the analysis of the summer outreach that I performed in 2024. To set the stage a bit, I'm not going to read this long quote, but I'll summarize it. It's Anisha Sivakumar, who was the 2024 Fritchie Health Policy Intern, wrote a report about some of the recent changes in coverage and enrollment among main care eligible children, really setting the stage for why outreach has been important this past year. Really highlighting the numerous policy changes that have occurred from our expansion of children's coverage to 300% of the FPL, eligibility expansion to children regardless of documentation status that was implemented in July 2022, the unwinding, the continuous coverage provision before the unwinding, and then Maine's Medicaid expansion in 2019. These really impact kids, but this also doesn't include some of the eligibility changes that have impacted adults. So our coverage of adult dental, eligibility for pregnant people regardless of documentation status, postpartum coverage expansion to 12 months, to name a few. So really the past 4 or 5 years has seen, and Main Care has seen an incredible change in our coverage and eligibility. And while that's great, I think it's also confusing for folks. And so by doing outreach, trying to educate folks and loop people into some of the changes that potentially may impact them. So I attended several outreach events. I've been calling it summer outreach, but really it was events from March through October 2024, targeting community members, providers, and different organizations. This was really the first year we've done a large outreach push. I started this role in 2020, but that was still pretty new into the pandemic, and really it's only been in the past year or two that things have really started opening up and happening more in person. 3 main goals for this outreach: promoting MaineCare as comprehensive quality health insurance, wanting to educate Mainers, so the public, providers, community organizations, really all folks in Maine about MaineCare. I did this by answering questions people may have about their existing coverage, how to obtain MaineCare coverage, and specific questions that they may have about program options. Answering questions and or connecting folks to those entities where they could get answers to their questions. And then finally, reducing the stigma of MaineCare. I think this last one is much easier said than done, and I certainly don't think that a summer's worth of tabling is going to completely eliminate the stigma of MaineCare, but is something I kept in mind as I attended events this summer, by providing info about MaineCare and working to make MaineCare a more recognizable name across the state. And these goals ultimately contributed to the overall objective of connecting eligible people to MaineCare so they can receive coverage. We want people to have access to preventative health care, and we want people to be thriving and contributing members of their homes and communities. And so this was important for me to, sorry, my mouse is being funny, important for me to consider when planning and strategizing for the summer. So a bit about the methodology. So what data I used and how I decided where to go this summer. So the first thing I did was I looked at MaineCare enrollment data to see where in Maine are children currently enrolled. Pulled kind of the top 30 zip codes and was able to kind of tally them by county. And then I looked at Maine Children's Alliance, their kids count data, to look at uninsured data. So where in Maine are there children who are uninsured? So, and this was split into both low income children and children of all incomes. So you can see there are some overlaps here. So Hancock and Lincoln counties are the top 2 counties for both kind of income splits sections, but there are some differences. So Cumberland County had a high percentage of uninsured low income children, but a really low, the lowest percentage of uninsured among kids of all incomes. So was able to kind of compare these data and ultimately develop an outreach list comparing those two. And this map here on the right, the stars show the counties that we kind of deemed high priority counties. So really concentrating in southern Maine, mid-coast, and down east. To develop this outreach list, using these high priority counties, did some research and found different events across Maine that I could attend. Also worked with the Maine Federation of Farmers Markets. They have a really comprehensive farmers market list across the state. So I was able to use that and reach out to the market organizers in some of these high priority counties to attend farmers markets. Looked and attended fairs and festivals throughout Maine, especially in these high priority counties. There is some departmental collaboration with Maine CDC. So the Maine Breast and Cervical Health Program and WIC also do a lot of summer outreach. And so we partnered to attend primarily agricultural fairs where they last for 5, 6, 7 days. And we partnered together to table for the duration of those for all 3 of our programs. I attended conferences and then also presented at community-based organization meetings. And so what did this result in? In total, I attended 22 events. Over the 5 or 6 months, about 1/3 of those were farmers markets, and then the rest was pretty evenly distributed among conferences, community organization events, fairs, and festivals. And this map here on the right shows where I attended those events. And so if you remember that map a couple slides ago that showed the high priority counties, it overlays pretty well. So I would say this was a success in kind of reaching the areas where we wanted to reach. At these events, I took a lot of information, so a lot of print materials highlighting a lot of different MaineCare programs. So our children's coverage, our postpartum expansion coverage, those new coverage groups for people without documentation, our FIP program, Maine Mom, information about the unwinding, etc. I also brought eligibility guidelines and MaineCare applications from OFI. We have cards that have contact information for both OMS and OFI and kind of list who to contact when, depending on what question you have. And then brought other resources as well. So some department-wide initiatives like Be There For Me. Rachel Collmore from CAKE provided me with some great CAKE resources to bring. So this is not a comprehensive list necessarily, but really brought all sorts of things for folks. And then at each event, I, whenever I was asked a question or you kind of given any sort of comment or feedback, I wrote it down and kind of logged it in my Excel form when I came back. And at the end of the outreach was able to kind of analyze what were the kind of topic areas or key areas where folks had the most amount of questions or feedback. And so OFI received the most, and by OFI, that was really anything to do with eligibility or applying for MaineCare. So if someone had a question about what the eligibility guidelines were for a specific program, or asked how do I apply to MaineCare, or had questions about wait times for calling OFI, anything like that was I gave this keyword. And so really ultimately it was people had the most questions about actually applying for MaineCare and working with through eligibility. We got a lot of general feedback as well, and I would say by and large this was really positive feedback of how MaineCare has made a difference in their lives or in their children's lives. We received some dental questions, mostly around having trouble finding a dentist, and do we have a list of dentists who accept MaineCare. And then some varied questions here. Medicare Savings Program, I think especially with the recent changes to MSP program. What services do we cover? We received a lot of questions around general resources. I think people see our state logo and don't always know kind of what office manages which program. So received questions about childcare, about SNAP, about different state resources. And here's some other areas that had kind of lower total numbers, but really was quite a breadth of different feedback and questions. Just to kind of wrap up, I would say a summary of kind of the summer and things that I learned. The more local the event, the better. So some of for example, the festivals that I attended ended up drawing in a lot of tourists, both from out of state, and those weren't necessarily the best events to attend because they would come up to the table and then I'd find out they're visiting from Florida, and they're not really our target audience for talking about MaineCare. So I think really trying to find events where the people who actually live in those areas go to. And this kind of connects with this last bullet around partnership and collaboration. I think working with community organizations and folks who organize in those high priority areas, partnering with them both to find events to attend, but then also collaborating on messaging and kind of sharing efforts is key and helps us be more successful, especially with limited resources in terms of staffing and travel and things like that. Another limitation was just some of the high priority counties are harder to travel to and reach, especially from kind of my, where I live. It's not always feasible to make a 3-4 hour round trip drive in a day to attend a farmer's market. So again, connecting with organizations and partners in those areas, I think will help with that limitation. And then just bringing a wider breadth of materials to events. I think based off the feedback and questions we received, people have a lot of questions about all sorts of both MaineCare programs, but also state programs. And so within reason, being able to, if not answer those questions with materials, have contact information or know who or where to direct people to with, so that they can get their questions answered. That's all I have. I can put my email in the chat, but I'll stop sharing here so I can see folks, and I'm happy to answer any questions or take any comments. We will be doing outreach this next year as well, and so really open to ideas people have or opportunities for collaboration or partnership. Thank you.
Thank you so much, Sarah. It's great to see all that work. Are there any questions? Okay. Then let's welcome Michelle Probert to the meeting, and I'll pass it over to you for any updates from MaineCare.
Thanks, Kathy. Good morning, everyone. Nice to see folks. It feels like it's been a little while. I hope everybody enjoyed the holiday season, and Happy New Year. My name is Michelle Probert. I am the director for MaineCare. I use she, her pronouns. I have a few brief updates today. Let's see. I didn't think through my head which I wanted to start with. So first, I will just acknowledge since we last met, there has been a lot of internal budget work going on, not just within MaineCare or within the department, but within state government as a whole. Per statute, the governor's budget is supposed to be scheduled to be released this Friday. I don't have additional information on that process, but I can confirm that that is the statutory deadline. I want to acknowledge that since we last met, I believe it was since we last met, we sent out the notice that we would not be proceeding with January 1 cost of living adjustments related to budgetary concerns. I am not able to speak in more detail about the budget or budgetary decisions until release of the governor's budget. So I just wanted to let people know. I know it's a little bit awkward, but I can't, there's not really a lot that I can say today other than acknowledging that we never make these decisions lightly, not easy decisions to make. And just for awareness or as a reminder to folks, and this is true for any offices and departments within state government, we do not have autonomy over our budgets. This is it's part of a broader state process. So the department has a process that it runs across all of its offices when we determine budget priorities, as well as what we have capacity to do. And then those department conversations also need to be part of a broader state conversation with the governor. And so that is partly why I can't just sit here and tell you about the decisions for MaineCare, because they're not just our decisions and they're part of a broader context. So I think that is, I will also say, and I did join the rate setting subcommittee last month where I made some similar comments. But I will also say that I have tried to be as transparent as I've been able to in these meetings to indicate that we do have concerns around the budget, and I had not intended to limit those comments to just the biennial versus this current fiscal year. Those comments, while I I don't think I specified were really intended as general comments for the current and planned budgets. So I think more to come. If this meeting were next Tuesday, then we could potentially have broader conversation, but the timing is what it is. So I wanted to share that. Also, I know that there have been questions and comments, and I acknowledge that we are later than we have been the past couple of years in terms of our process for putting out our planned schedule of rate determinations for the calendar year. We are planning to release a draft for calendar year 25 next week. Acknowledge that there has not been public process yet, but because we are so late, we wanted to get something out, and then we will be following up that draft with the public process between our technical advisory group, the TAP, as well as the rate setting subcommittee. So the process will be forthcoming, but we didn't want to delay getting some information out there. And so are aiming to release a draft of the schedule for next week, and nothing precludes us from updating that schedule after we have had further conversation, and we would anticipate that there likely will be updates because things always change within state government. So I wanted to provide that update also. And my third update on a high note is if you didn't hear driving to work this morning, potentially very exciting news that MaineCare was selected by Center for Medicare and Medicaid Innovation as one of 15 states to participate in the Transforming Maternal Health model. You may have heard some folks call it TMA if you're in the know. But this is really intended to be a transformational effort. It is a 10-year grant, about an estimate of $17 million over 10 years. You may be aware that we have struggled, especially with continued rural access to maternity services, and this grant is really a great opportunity that focuses on the whole picture. From the kinds of services provided, where are they provided, how do we pay for those services, and also the initiative is really grounded in making sure that we are hearing from all community voices, including people receiving pregnant people receiving services, providers, community partners, etc. And also a big focus on equity and the fact that everyone deserves to have access to quality birthing care, perinatal and postnatal care. So we are excited, and there will be a lot more to come. And that's it for my updates. Any questions?
This is probably a better question from Laura, but in terms of recognizing that there's limits to what you can say right now about the budget, and recognizing that a lot of the concern around the budget is related to rates, so obviously that's not the only thing that's impacted by the budget. Do you think it would be possible, because we don't have a MAC meeting in February, so I guess I'm just wondering if it'd be possible for you to attend the rate subcommittee meeting at the end of this month, so that there's a space where that conversation can happen. And Laura, I don't mean to step on your toes either, if that's not working with your schedule.
Is there a date for that meeting yet? Is it the 27th, or Laura?
Laura, go ahead.
And good morning. Thank you. And thank you, Kathy. And good morning, Michelle. I'll hop in and say, yes, I sent the dates of both the 6th and the 27th. We happen to have 2 meetings this month. One was yesterday because we didn't meet officially in December, although I was going to say this in my report, but I will certainly thank you for squeezing in a meeting with us to talk about the lack of scheduled COLA for January 1. We would welcome any and all information ahead of and or following the release of the budget, especially if, I think my question was going to be, Kathy, could you share with us, regardless of, what may or may not be in the budget, what is the amount that is needed to meet the January 1 COLA for the 14 main care sections that are scheduled to need it? And, and or what is the percent COLA that the state is needing to meet its obligation? Thank you.
Thanks, Laura. I should be available on the 27th, and I'm happy to plan on that time. Also appreciate your specific questions, and we can. I did receive those questions. We've been in a bit of a budget crunch with trying to produce lots of analysis and documentation that we have to internally, so have not been able to make progress on those requests. But I think we can plan on a meeting for the 27th and agree on agenda for that meeting. That sounds good.
Wonderful, thank you.
Can you, I know you said you emailed this, but just so I put it on my calendar right now, can you remind me what time that is on the 27th?
Sure. It's Monday the 27th at 2 p.m.
Okay, and is that scheduled for 1 hour generally?
Yes.
Okay, great, thank you.
Thank you.
Thank you both. And thank you for all those updates, Michelle. Exciting news, especially about the maternal health grant. Do you have anything else? No. Okay.
I do not. Thanks.
Okay. I'm going to then move us along and pass it over to Sanaa to talk about the Beneficiary Advisory Council, the BAC, which is in the recruitment phase right now. So Sanaa, go ahead.
Hi again, everyone. Sanaa Osman again, Member Engagement Manager. And I'll give a quick overview about the Beneficiary Advisory Council's recruitment strategy that we have been working on. Next page. So for this BAC to succeed, we have to rely on inclusion and active participation and experienced member or members with lived experience, and they have to be diverse and we have to hear from their perspectives. And the strategy seeks to ensure that the council is representative of all main care member populations that we have and provide insights to inform main care and shape the Office of Main Care decision making. Next page. And I will go through just the steps and overview of the steps of this strategy. And so we started out with the promotion. We're going to start out with the promotion of the BAC. And the hope is we'll be able to start that in the middle of this month by the 15th, hopefully. The application review, and then interviews with the candidates. And then we'll go to the selection process. So for the promotion, we have created a flyer, and I think Kathy shared that flyer with you. The flyer contains the Beneficiary Advisory Council criteria, the compensation that they'll be getting for joining these meetings, and who to contact if they need more information or to access the application. And the flyer will be translated to the most common languages among our main care members, which we have the 9. We're going to use the first 9 languages common within our populations. And the distribution of the flyer, we have listed a lot of avenues or ways that we can distribute that flyer. So we're going to start with the MAC here and the main care e-messaging services that we have, community-based organizations, CAP agencies, DHHS offices and libraries and YMCAs. Federally qualified health centers, and I have in my list also AARP and then the Office of Health Insurance Marketplace. We have a lot of email listservs that we can distribute through. There's also a HUD group, which Cake is going to be our contact for most of these. We have a lot of resources through them. And if any of you can think of anything else, maybe we can add also to this strategy. Next page. So for the application itself will be with Cake, so through Cake, and they will, it will be in a Google Doc format. And it can be printed. We will have it as a PDF too, so it can be printed and people can fill it out and send it in or scan it. And also if English is a second language, they can call in Cake, or Cake will help connect them to a way where they can fill out this application. Next slide. So for the application review, Cake will receive the application and will select up to 25 members. So the idea is to have a council formed of 50 members, but we want to be able to have a number of applicants where we can go back to them. We can use them later if we want to recruit furthermore back members, or we can also reach out for any other efforts that we're trying to do. And the MaineCare staff will review these, and as I said, we're going to reserve them for the rest of the application will be reserved for future back recruitment or focus groups or town halls. And the applicants should be selected using these following criteria. So we looked at the location. We are going through and we are going to share it with, we already shared it with Cake, the data that we have on the demographics and the location of our members and which counties have the more MaineCare members. And so this is going to be the target for us is to be able to include as many members as we can from different counties, and the counties that have larger populations will have more members in the council. And also association to MaineCare, meaning are they current members? Are they previous members? For the previous members, we're thinking to have at least for the past, like they've had MaineCare within the past 5 years because of the changes to MaineCare. So not before 2019, for example. And then another association is the caregivers, which is you can be a family member paid or unpaid caregiver, and you can also join. The type of MaineCare people have, whether it's full MaineCare, pregnancy MaineCare, special benefits waiver, emergency MaineCare, any type of MaineCare that they have. Population demographics, as I said, they could be a parent, a guardian, an older adult, belonging to a certain group of people, Native Americans, LGBTQ communities, people who have experienced homelessness. So we're trying to reach out to as many populations as we can and to be able to include them as part of the group. And the goal is to be able to have at least 33%, which is about 5 members who are previous members of MaineCare or caregivers, and the rest, which is about 67% or 10 members, to be current members, and at least include five counties. And we would have some rural counties, and if not a rural county, maybe a town within a county that is rural, that somebody from that county is represented and is presented in this group. The next step is the interview. So we will be the ones interviewing, and we have just basic questions about what MaineCare is to the member, why are they joining, what do they think they can bring in, and if there's any accommodations, if the stipend is going to affect their eligibility, we're going to look into that. That's something that we have to look into once we offer stipends, and if there's any ways that we can avoid them. We don't want our members to lose MaineCare just because we are providing them with a stipend. So this is something we'll be looking at as we interview members to join the BAC. And last but not least is the selection. So we member engagement team. So now we are a team. So it used to be just me. Now I have Kat, but we're still, the communications team is very involved in general. And so we will pass a recommendation along with the demographics makeup to the director, to Michelle and Courtney, for the medical director of the people that we selected. And the communications team will send out a letter of appointment and also a formal invitation to the group. And we will send out letters also to the people who haven't been accepted, letting them know that we are keeping their applications for future contact maybe, and we will reach out in a different time if they're not selected at this point. And that's it for me. Thank you very much. And if you guys have any questions, feel free to ask.
Thank you, Sana. Are there
You're
questions?
welcome. And I did share the application, as I said, the application and the flyer.
Yeah, I shared them with the list and
Yes,
I'll reshare
yes.
them again too,
Yes.
along with some of the other links from this meeting.
Okay, thank you.
Hi, Kathy and Sana. Sana, thank you so much for, this is Deca Della, CCCS. What's the number of people that you are selecting for this committee or
We're thinking
advisory committee?
15. We're thinking 15 for the whole back
So, and that would be across the state, am I right?
across the state. Yes.
And their meetings, I'm hoping, it's going to be in Zoom because of the fact that it'll be very difficult for community members to do transportation and travel, especially if they are receiving MaineCare and TANF and all of those other state
Yes.
benefits. Okay.
Yes, we're trying to accommodate everybody. We're trying to make it as hybrid. Maybe if people are willing to join us, we'll do a hybrid meeting. There's a call-in option, and also they can connect through Zoom, as you said.
Okay, thank you.
Yeah, you're welcome. Any other questions?
Well, it's
Thank you.
I look forward to having the back be
Thank you.
in place and working with us. Thank you. Great. So our next guest is Samantha Liang from the Office of the Health Insurance Marketplace, and they're going to talk with us about expanding access to women's health and an outreach grant that they have.
Thank you, Kathy. I'm just going to share my screen really quickly. Okay. Are folks able to see the large presentation?
Yes.
Okay, great. Well, hi everyone. As Kathy mentioned, my name is Sam Lang. I use she, her pronouns, and I am the outreach coordinator for the Expanding Access to Women's Health grant that sits at the Office of the Health Insurance Marketplace, which operates CoverMe.gov. And thank you all for having me today. So some quick background into this grant. So it's a 2-year grant. It ends in September of 2026. And the purpose is to try and expand access of reproductive and maternal health services through helping as many people get health insurance coverage as possible through CoverMe.gov, the state-based marketplace, and through the MaineCare program. So an important part of this grant is that we are working to address health disparities, and we know that BIPOC or Black, Indigenous, and other people of color communities have worse health outcomes compared to white folks in Maine. BIPOC people additionally have less access to prenatal care, despite all major health insurance plans covering pregnancy care, including birth control and prenatal care. So people in the reproductive age bracket of 15 to 49, roughly, are also more likely than the general population to be uninsured and less likely to have private insurance through an employer. Oh, I also want to mention, I can't see anyone on my screen. So if you have questions or anything, or the chat, so if you have questions or anything, feel free to shout them out, or we can talk about them at the end. But yeah, I just wanted to make that note because I can't see anything. Okay. So the target audience for this grant are people of childbearing age, so 15 to 49, who are potential and current customers or consumers of CoverMe.gov and MaineCare. There is a focus on BIPOC populations and individuals in low socioeconomic status. Our goals of this grant are to expand access to reproductive and maternal health care through getting more folks covered by insurance. We hope to educate people about what their insurance coverage actually provides in terms of reproductive and maternal health services, such as maternal mental health care. And lastly, we hope to reduce disparities in access to reproductive and maternal health care in both receiving actual care and being covered to gain access to that care. We plan to reach these goals through developing outreach and educational materials that will live in a resource library on the coverme.gov website. We aim for that to be evergreen, and so it will live on and the information will be helpful past September 2026. We plan to create a decision-making tool similar to the plan comparison tool that currently exists on the CoverMe website. If you're not familiar with that, it essentially people can put in, they can input their doctors, their income level, the types of medications that they're on, and ensure that their health insurance plan covers all of those things. We also will award mini grants to organizations to support that outreach work. And those grants will be 2-year grants. And then lastly, we will have social media and traditional media campaigns. Right. So right now I'm working on finding different groups and organizations that are interested in engaging in this work and being part of our stakeholder group. So early this year, probably March, I plan to hold a stakeholder workshop so that the stakeholders can inform and shape the education and outreach plans that we hope to bring to focus groups and then to the larger public as a whole. And so that's what step I'm on right now. Yeah. If your organization is interested or you have any groups or organizations in mind, please let me know. Here is my contact info. Please feel free to share it. And I'm happy to chat with anyone about this grant more in depth. Thank you all for your time and feel free to reach out.
Is there time for questions?
Yes, please ask.
Woohoo! Okay. And Kathy, I've been on since this is Sarah Lewis for a little while, and I texted you. I'm so sorry. I'm late, everyone. I have a question about, you had me at grants coming up. When will those grants, the opportunities to apply for those grants be available? We do a lot of outreach with the community to get folks connected to MaineCare, to get folks connected to health insurance, to get them connected to all of their services, especially with maternal child health. And I'm just wondering if there's anything that's coming down the pike that could help support that.
Yeah, so great question. The idea right now is that this the mini grants, mini awards will go out middle to end of this year. So they will go out soon. And the application process, we haven't created the application yet, but we do aim for it to be pretty accessible, very short, and without a ton of barriers, especially to community orgs or ECBOs. We do want this work to be really accessible. And the grants are, I guess it would technically be for 1.5 years instead of 2 years, but it would be $42,000 for the course of the rest of the grant whenever it goes out to September 2026.
And thank you so much for that. Will the application link, or forgive me for not knowing how to, but I just want to make sure I don't miss the opportunity to apply with all the emails coming through. Will it be shared perhaps in a MAC, to the MAC membership, like email listserv?
Yeah, so we are working very closely at OHIM, the Office of Health Insurance Marketplace, with the Office of MaineCare Services, with Kayla and Sarah specifically. And so once I have the application created, I will share it with Kayla and Sarah, and I'm sure they will share it with everyone that they can.
Okay, cool. Thank you so much.
Yeah, of course.
Sarah, I can make sure, this is Sarah Fisher, I can make sure that if it's not sent out through the MAC for some reason, I can make sure that you receive it.
Excellent. Thank you. Yeah, it just would fill a funding gap for something we're doing already, but it would be great. So thank you.
Any other questions? Well, thank you so much for joining us today and sharing information about this great outreach work.
Thank you for your time, everyone.
So next up, catching up on a lot of presentations today, we have Jan Wright to talk about an upcoming MaineCare pharmacy change.
Hi, everyone. So sorry, Kathy. I have a last minute update on who's giving this,
Oh.
this talk. It's me.
Oh.
Jan Wright, our acting associate director of pharmacy, unexpectedly couldn't be here with us today, so I am going to share on her behalf. I do have Tammy Sheehan from our pharmacy benefit team here to help me with more of the technical information or as people have questions. And I'm going to share the situation to the best of my knowledge right now with you all. So basically, the 21st Century Cures Act requires MaineCare to enroll all medical providers furnishing prescriptions to Medicaid beneficiaries. And our pharmacy team now has the tools they need to start enforcing this requirement. The exact implementation date of this hasn't been chosen, but tentatively we're planning for the end of March or early April. And essentially our system will no longer allow MaineCare to cover prescriptions written by non-enrolled prescribers. If a provider does not want to enroll as a MaineCare provider who accepts MaineCare payment, they may enroll as a non-ordering, prescribing, and referring provider, which we also refer to as NOPers. This type of enrollment meets the requirement for the 21st Century Cures Act and assures that patients and our members will continue to receive coverage for the medications prescribed for them. What I'm going to walk you through today is our plan for communicating about this. We started working on both a member and provider-facing communications plan. We have the tentative provider plan ready, which I'll run through with you all, and we'd like your input as to whether you have additional ideas for our communications and things that we need to be considering from your perspective. And then I will also share the draft version of our member outreach plan. That subgroup hasn't finalized the plan yet, but I'd like to give you all a heads up on what they're thinking just in regard to timing of these meetings. Recognizing that when we meet again in March, it will be the same month that we're planning on implementing this. So for our provider communications, we are planning on a proactive outreach method from our provider relations team. So having our provider relations team batch communications based on taxonomy, larger healthcare systems, to proactively outreach as we see these prescriptions coming through from providers who aren't enrolled in MaineCare. We also want to draft some messaging for partners to share on our behalf. So we would share this messaging with the MAC, also with hospital associations and the Board of Medicine. We plan to put a notice on our Health Pass portal in the announcement section, as well as call out boxes on our public facing website on the pharmacy provider page and the general MaineCare provider page. We'll provide scripting and FAQs for our call centers. So our provider facing call centers, our member services call centers, we will share it with OFI for the eligibility specialists and any other supporting call centers that we identify. And we plan to share general e-messaging through our provider curves to both prescribing providers and pharmacy providers. I'll pause there because that's the provider focus, and then take any questions, suggestions, comments, and I'll give Tammy also an opportunity if I missed anything or misstated anything to jump in.
No, I think you hit it all.
Thanks, Tammy.
Sorry, Tammy. There's a question in the chat about providers who write prescriptions while their enrollment is pending. Will that cause problems for members?
It will. Yeah, until the enrollment's done. Probably the best thing to do is if there's maybe another prescriber in the practice that is already enrolled, to have the prescription dispensed under their NPI number.
Other questions or suggestions around the provider outreach plan? It sounds like it would be good to include that information so people that in that question, because I'm sure others will have that question too.
Yes, thanks, Kathy. I did take that down, and I will say if you have suggestions for things for considerations for our communications, we'll take that down today.
Great. Melissa?
Okay, good morning. I just wanted to verify really quickly. So what you're suggesting is if the MaineCare provider isn't enrolled yet, they're going through the process to ask another provider that hasn't seen a patient to sign off on the prescription?
I find that in most of the data that I've looked at is these are usually providers that, like a student possibly. I don't know what the general practice is like in a health center or something, if a doctor's seeing a patient and they're prescribing, how that would work out with other providers as far as that's in that same place.
And I guess my only other follow-up to that would be I mean, we might be different because we're dental, but still all of our doctors do have the ability to prescribe medications. What if it's a solo provider in that particular center? What would the fallback be on that?
I'm sorry, could you repeat the end of that?
Oh, of course. So what if our doctor is a solo provider in that practice?
We're trying to do outreach to get these providers to enroll, as Kayla had mentioned about the NOPR enrollment. So even if it's a provider that doesn't want to accept main care payments, they have the opportunity to enroll as a non-billing provider so that they can continue to provide to our members so that the prescriptions are paid for.
I apologize, probably should clarify from the beginning. When they're going through the process, so sometimes enrollment can take 30 days, other times it can take up to 90 plus days. So during that time frame, if they're the only solo provider, is there another option for prescribing medications?
Not that I'm aware of. The system will see it as a non-enrolled provider. I think this is some of the stuff that we need to work through and to discuss to see if we can come up with other options, but I'm not sure.
Okay, thank you.
And maybe you said this, Kayla, and I just missed it, but is this a change that's coming? Is this like a federally required change and that's why we're going through this? Or is this something that MaineCare has decided to do for some other reason? Because that might be helpful for providers to understand like where this is coming from.
Yes, absolutely. It is federally required. This is not a MaineCare based decision. We are making this change to get in line with requirements of us. Yeah.
And I think, Tammy, you can correct me if I'm wrong, but I think that we have been working on this and sending out communications about this process for over a year, maybe?
Yeah, it has been over a year.
Yeah.
I think the big change here is we have been kind of like warning that it's coming, but we never really had a date for when we were going to implement. And we're much closer now. We know it will be the end of March, early April, and should have a date relatively soon.
Is there a difference in terms of how long it takes to enroll as a NOPR provider? I missed what the P stood for, but versus a, like, I understand that enrollment as a provider generally takes, as Melissa said, like a certain period of time that can vary up to 90 days. But is it quicker? Like, if I guess I'm thinking about these circumstances where someone might not be in already enrolled and there could be a challenge. Is that like a quicker process or?
Yes and no. So the time it takes to process the case is faster. Cases are processed on a first come, first served basis. So it would still be in like a waiting queue until the case is submitted before that were processed. So it should be faster to process. The overall timeline we cannot commit to though.
Any other provider related suggestions or questions? Just lifting up from the chat that it sounds like right now enrollment turnaround times are under a month, so and have been, so that's hopefully helpful as this goes forward. Okay, Kayla, do you want to talk about the member outreach?
Sure. So I will just give you some ideas we have so far on member outreach and welcoming more from you all on this. I think our biggest priority is this provider outreach beforehand so that we can take the onus off of our members and try to bridge this all off at the pass. But for member communications, we do plan on sending out some targeted messaging through e-messaging for members who've opted in. And just to those members who we can identify are partaking in the pharmacy benefits We will provide scripting for pharmacies so that they have tools from us to assist as members are coming into the pharmacy and potentially running into these situations, or if they can flag these potential situations ahead of time. We'll provide education as well for pharmacies to have on hand, whether that be posters to display or education to hand out to our members to try to explain the situation and what's happening. And then we do plan on drafting some general messaging to share with our community partners and the public, and that we'll share online.
Questions or suggestions? The plan sounds good. I mean, I think it'll be good for partners who are really engaged with members to really understand what's happening, because I think what's likely is that people will just miss the outreach because lives are busy. And so I expect, like, at least I know we at Meaningful Justice will probably get questions. And so it'll be helpful to make sure that lots of partners across the network really understand what to tell people if they're experiencing challenges. Any other questions or thoughts? Okay, thank you, Kayla.
Thank you.
So next up is a quick, I'm going to shorten this a little because of time, but just to name that the access rule, as many of you hopefully remember, last year, CMS, the federal entity that oversees MaineCare, it enacted a new rule, the access rule, which we've talked about at previous meetings. And if you have questions about that, feel free to reach out to me or Kayla, and also can share information from those previous meetings. But along with other changes, it requires changes to the MAC model in order to try to increase member participation in the MAC. And by member, I mean members who are insured by MaineCare. And as you heard Sana talk about, that we're trying to do that work on the outreach for the back. And along with that, there are also some other changes that have to go into effect. For example, there needs to be 2 opportunities each year to accept public comment, and an opportunity both for the MAC to respond to those comments and also MaineCare to have an opportunity to respond. There needs to be some changes we need to adjust the frequency of our meetings, which we talked about at our last meeting, in order to create space for the BAC to meet and be able to provide input to the MAC. So, and BAC members will also participate in MAC meetings. So that's why we've switched to this every other month model that we've gone to. All of those types of things, also thinking about how we work with MaineCare to provide guidance. That's another piece of the access rule, which has been a purpose of the MAC all along. But I think we've got more clear guidance from the feds about their intent behind that. All of that would be helpful to have some additional input around like our rules, our bylaws as the MAC works together. And so I had hoped we were going to be able to meet in December to talk about this. I was sick and didn't make that happen with the holidays. So I put together an updated doodle for us to find a time this month to meet for those of you who are interested. So this is not a requirement, but for those of you who are interested in these issues, I put the doodle in the chat, but I'll also share it after the meeting along with those other materials. Particularly if you're a MAC member or alternate, would love to have your insight into how can we make our work together going forward work as smoothly as possible. Also, just naming out loud that we're going to be doing some of this governance work, but then at some point we'll also need feedback from the BAC about governance changes, because obviously ultimately part of the goal is to have the back be a more guiding force for us. So we wanted to start the process because the timing, I meant to say this already, this is what happens when I shorten what I was going to say. The timing for the implementation of different changes is staggered. So some things need to go into effect by July of 2025. Some things don't need to go into effect till the end of the year. Some things don't need to go into effect until July of 2026. And so we want to make sure that we're looking like, what is the long-term shifts that need to be made? And also recognizing that it's going to take some time for the back to get fully recruited and really be meeting and be able to give that input. So wanting to get some things moving, but recognizing that we'll have to have input at some point down the road. So I just want to acknowledge that it's a little bit of a complicated part of this process since the back doesn't already exist in its entirety. So we're going to start that process. If you're interested, please do complete the doodle. I'm going to ask folks if you could complete it by the end of tomorrow so that we could get the January date on our calendars, and then we'll schedule another meeting for February. And I'll share that doodle with the whole group or that date or the doodle, depending how we decide to schedule it, with the whole group in case some folks who can't come in January want to attend in February. But would love to have your support and help in trying to figure that process out. And with the hope that we could bring something, at least some initial thoughts around that to the March meeting. It probably won't be final, but like have some initial opportunities for feedback. I also just wanted to thank Kayla a lot around this whole process because she has been really looking so closely at these changes. And has helped by creating like a great spreadsheet that shows us all the different things that we have to do to be in compliance and what the timing is for those things and who's responsible for those things. And we'll share that as well in March to have, and we'll share it at this meeting to do planning as well. But I definitely would not be able to keep track of all these things if it weren't for her help. So thank you so much, Kayla. And if anyone has questions, feel free to reach out to me. The other thing I just wanted to note, which is sort of a housekeeping piece around the MAC, not related to the access rule, but I will talk about the access rule, is that every year when the legislature kicks off, every 2 years, I'm invited to go present to the Health and Human Services Committee about what is the MAC and what does it do and who is in it. And this year I'll talk a little bit about these changes that are coming up for us as well. That I think I just heard from their analyst. So I think that's going to be scheduled for next Thursday afternoon, the 16th. It'll probably be scheduled for like 2, but who knows what time that it'll actually happen. But sometime that afternoon. And I'll share the video following after that committee meeting closes, a video will be available. So I can share that video out with the whole MAC as well. Any questions about any of those things?
Kathy, it's Sarah Lewis again. Do you need anything from any of us from the members of the MAC for that Health and Human Services meeting?
I don't think so. Thank you. I don't think so because it's pretty brief. Like the time they give me is pretty brief. So I have like a presentation I've done the last 2 sessions, I think, that I can just adjust. And then I thought I'd add a little bit about the access rule changes and what the back is and some of the recruitment outreach around that. So it's a pretty high level overview. And I'll pretty much say a lot of what I've already said before. So I think I appreciate the offer though.
Yeah, a humble offer. I would have mostly would have been me in the background just cheering for you, but yeah.
Thank you, Sarah.
Yeah.
Anything else? Okay, so then let's move on to subcommittees, and I'm going to take them a little out of order. I've been trying to figure out how to modify things in order to make the agenda work, and Kayla had this great idea around in order to fit all the things we need to talk about, to have the subcommittees going forward to be trying to focus more on like what are actionable items that it's important to lift up for the MAC, or if there's specific challenges that it feels important for the whole MAC to know about, or successes too from subcommittees, that, you know, trying to keep things like what's most important for the full MAC to know about what's happening within the subcommittees. And if there's places where we need action to really focus on those. So I did just want to quickly flag for the dental subcommittee that I shared in the agenda a link to an updated metrics report that comes from MaineCare about utilization of the dental benefit. A lot of the data is focused on adults, but it also includes data around children. And I think the subcommittee was supposed to have a presentation last month on the metrics, so we'd be a little more familiar with it for today. But unfortunately, due to some challenges with the report, it needed to be delayed till this month, which is tomorrow, I guess our meeting is actually. So we'll have more details after that subcommittee meeting, but I know there's folks who aren't part of that subcommittee who are interested in what's happening with dental. So I shared that metrics here. We're also just naming that we've been spending a lot of our time these past few months trying to deal with some challenges around that were still left over from the Change Healthcare debacle at the beginning of last year, where some providers in the dental community were still having challenges being able to electronically submit claims. And that's been a real burden for those providers. So especially providers who see a lot of MaineCare patients. So that's been a lot of our focus these past few months. I don't think there's anything actionable for the MAC as a whole at this time, but we'll come back with more when we have it. And then I also just wanted to name that the provider subcommittee hasn't been able to meet the last couple of months. Jillian Jollikar had kindly offered to convene that group, even though she's not an actual MAC member right now, because when some of you know, Mallory Shaughnessy retired last year, she had been chairing that subcommittee and nobody else has taken on that role yet. But it really is a challenge for Jillian to do it. And then the holidays made it extra hard. So it is important that we at some point, if we want to continue to have a provider subcommittee, which was a decision we made to try to create a space where providers could really get into the weeds about issues that were challenging to have at the full MAC meeting, since a lot of people at the MAC are not providers. It's not really the space for getting into a really weedy conversation about most things. So it feels like an important space to continue to have, but if we want to have that space, I think it's important we need to have a chair and ideally a vice chair as well who can step in if we need it. So just a reminder that that's still a need. And if you're interested in helping support that committee, please do reach out and let me know. And we could make that transition happen. So those are the updates from those two committees. And Laura, I know you talked a little bit about some things, but do you want to share more from the rate subcommittee?
Sure. Thanks, Kathy. And I appreciate your and Kayla's guidance for what to lift up in this space. And I just have two things. I'll go back to noting, the issue of the COLA. I appreciate, again, the department taking time to meet with members of the rate system subcommittee. We tend to meet on the last Monday of the month. And I think if you were here earlier in the meeting, we're meeting on the 27th. In January, and we scheduled, ahead through June, the last Monday of the month. And here's at 2 p.m. and our link. Folks are welcome to send me an email to say, hey, I'd love to be on your list, but please know as a MAC member or any member of the public, we welcome folks to drop into these meetings. Nobody necessarily needs to be a member. I would just take a moment to talk about the COLA in relation to this committee, because it is a key part of the rate setting system that was forwarded by the department, that stakeholders were engaged in, that lawmakers lifted up and is now codified. And, really around the country, really Maine is lauded for, this rate setting system process. We're on a 5-year cycle. And I think the lack of the COLA was really a surprise to folks for January 1 in this fiscal year, where we have currently a budget surplus. But, I think the other piece is just to remind folks is that not only is a COLA helpful because of increased program costs, but we have a minimum wage that goes up every year. So we are 50 cents behind. The COLA is also used to meet another state statutory obligation, and that is to make sure that labor costs within rates for direct care service, main care rates, are tied to 125% of that minimum wage. So it's also impacting a lot of direct care service providers. And, in a competitive job market where we've had longstanding staff shortages, every, small increase we can give to folks that are staffing and helping Mainers for main care services means that we can retain workers and make sure we have, a plan in place to maintain access to services. I will also just say real quickly, as a, Maine or a MAC member and a rate subcommittee member, just our ability to figure out how to advise or recommend things to the department, is really contingent upon having information. So again, my thanks to Director Probert for agreeing to come into our meeting on the 27th and share additional information that I'm sure folks will appreciate having, because it's really challenging right now ahead of the budget to communicate what may be possible and what's needed, because we all want to lift up the system and advocate for what's needed in the budget. The other thing that I will mention real quickly, and I'll put this in the chat as well, is a work that the rate subcommittee or system subcommittee has done to create a small survey going out to MAC members to get feedback on the rate determination system that's been in place for a few years now. I've given those updates that we were planning on doing that. I appreciate members who've given design the questions. It shouldn't take long. Anybody could fill it out, but certainly organizations that are providing main care services who have gone through a rate determination process, your feedback would be particularly welcome. We're going to keep it open for a couple weeks, close it on January 24th. I will also send this out to the MAC list and invite folks to push it out to your network. And we will, at our next meeting, provide a summary. Individual information and responses will be kept confidential, but we'll put this together in aggregate information and share it here with the MAC department, and certainly anybody from the public who'd want that information as well. Thank you.
Thank you, Laura. Any questions for Laura? Great. Laura, I can share that out too with the notes from this.
Thank you.
Not the notes, but the links from this meeting. Great. So last up is just flagging the rulemaking updates that are part of the rulemaking packet, which was shared in advance of this meeting. And Kayla, I'm not sure, I can't remember who you said could be available to speak on this or answer any questions.
We have, oh, sorry, Jessica, go ahead.
No, it's okay. Hi, Jessica Miller. I'm here.
I didn't see this.
Yep. No, just quickly, the most recent update is that we did adopt the hospital rule in, I think the effective date was in November, which had some new updated methodology, and that was really making permanent a prior emergency rule. But that's the big update. And if anybody has any questions of anything in the packet, please feel free and let me know. That's it.
Thank you so much. Any questions? That's great. Okay. Well, we've caught up to being on time after all that. So thank you all for adjusting as needed. So just really quickly, I didn't hear, well, that's not totally true. What I did hear is that at a future meeting, maybe potentially the March meeting, we could get an update on wait times and whether there's any changes there from OFI as you're making these staffing changes. I didn't have any other agenda items that I flagged. Does anyone have any that I forgot to write down for next month? I mean, we'll have agenda items for sure, but I didn't have any that came up in this meeting as suggestions. Okay. And then I also just wanted to restate once again that in addition to needing a chair and vice chair for the provider subcommittee, we could still use a vice chair for the MAC. And then just a reminder about the meeting frequency. So we will not meet as a whole MAC in February. The group that's going to come together to talk about governance issues will meet in January and February. So our next meeting is in March. And I will share out after this meeting the links that were shared today, as well as the back application and flyer and I think that's all the things I said I would share out. Oh, and the doodle for the governance committee for those who are not here right now. Is there anything else that anyone needs? Great. Well, I hope the rest of your start to 2025 goes well and see you all in a couple months.
Thank you.
Okay.
Bye.